We will now discuss various ways to treat sleep issues. Cognitive behavioral therapy, or CBT, a psychological treatment focusing on the behaviors and dysfunctional thoughts that contribute to sleep problems, is one of the most effective treatments for insomnia. One study showed that almost 3/4 of participants saw improvements in the quality of their sleep within 3 months following a 60-minute cognitive behavioral therapy session. Adults who reported that they had suffered from insomnia for less than 3 months and who were not currently taking medication to aid their sleep took part. None had previously received cognitive behavioral therapy. All used sleep diaries to record the quality and duration of their sleep for 7 days before treatment and completed an insomnia severity index, which measured the nature, severity, and impact of insomnia. One group received treatment of a 1-hour, 1-to-1 cognitive behavioral therapy session delivered by a professor and a self-help pamphlet to read at home. The control group received no additional support. After treatment, there was a significant difference between the group that had received cognitive behavioral therapy and the control group. Within 1 month of the therapy session, 60% of participants reported improvements in their sleep quality. Within 3 months, this had increased to 73%. Meanwhile, just 15% of those in the control group who had not received the therapy reported improved sleep. On seeing the results, 70% of those in the control group requested that they also be given the same treatment. The therapy session covered sleep education and individual differences in sleep needs at different times of life. The professor then introduced the principle of sleep restriction, which encourages the individual to spend only the time in bed required for sleep. Using the recorded sleep diaries, the individuals were then prescribed a time to go to bed and a time to rise to improve their sleep efficiency. The self-help pamphlet used a 3D message, which represented 3 actions for the individual to recognize and act upon the symptoms of insomnia. Detect, how to record their sleep diary; detach, how to control stimulus that could lead to disrupted sleep; and distract, instructions on how to use cognitive control and imagery to distract their mind. This study shows that there are numerous advantages to treating insomnia during an acute phase. If successful, there is potential for significant savings in terms of long-term health care, lost productivity, and accidents. This becomes more pertinent when the costs associated with other illnesses, such as depression, for which insomnia is known to be a risk factor, are taken into account. Another meta-study examined the efficacy of cognitive behavioral therapy for insomnia in patients with psychiatric conditions, including alcohol dependence, depression, and post-traumatic stress disorder, and/or medical conditions, including chronic pain, cancer, and fibromyalgia. The authors included 37 studies in their final analysis. The meta-analysis by the authors found that, overall, cognitive behavioral therapy for insomnia was associated with reducing insomnia symptoms and sleep disturbances in individuals with coexisting conditions. At post-treatment evaluation, about twice the percentage of patients who received cognitive behavioral therapy for insomnia were in remission from insomnia compared to those patients in control or comparison groups. The therapy also was associated with positive effects on coexisting illness outcomes, but the extent of that symptom improvement was determined by which type of coexisting illness patients had. For example, individuals with psychiatric disorders had larger changes than those with medical conditions, according to the analysis results. The authors note sleep disturbances may be more strongly associated with cognitive emotional symptoms than physical symptoms, so reducing sleep disturbance could have a stronger effect on psychiatric illness. Another study showed how CBT can positively impact both insomnia and inflammation. The study showed that reducing insomnia can lead to decreases in inflammation, and that cognitive behavioral therapy proved superior to other forms of treatment. There is believed to be a link between insomnia and an increase in inflammation throughout the body that may become chronic. Though inflammation can be a good thing, part of a robust immune response that heals injury and fights infection, chronic inflammation can damage and kill healthy cells, leading to disease. The researchers in the study compared 3 treatments for insomnia: cognitive behavioral treatment, CBT, which helps people learn how to identify and change destructive or disturbing thought patterns that have a negative influence on behavior; Tai Chi, the westernized version of the Chinese martial art characterized by slow movement and meditation; and sleep seminar education, which provided educational information related to the physical, medical, and psychosocial factors of aging and their contribution to sleep problems. Researchers found that, by far, cognitive behavioral therapy performed better than Tai Chi and sleep seminar education in reducing insomnia, and also showed greater and more sustained improvements in sleep quality, the ability to maintain continuous sleep throughout the night, and study participants' reports of fatigue and depressive symptoms. In addition, those who got cognitive behavioral treatment showed a reduced rate of diagnostic insomnia that was nearly double either of the other 2 treatments. Results of another study showed that sleep improved in 86% of insomnia patients who completed at least 3 sessions of CBT. In the 6 months following treatment, healthcare utilization decreased and healthcare-related costs were reduced by more than $200 on average among treatment completers. Components of the treatment included sleep education, sleep hygiene, stimulus control therapy, sleep restriction, a 10-minute relaxation exercise, and cognitive therapy. Up to 6 weekly treatment sessions were led by clinical psychology graduate students and pre-doctoral interns. Several indicators of healthcare utilization and costs were measured over a 6-month period prior to and following treatment, and included number of physician office visits, costs related to office visits, number of medications, and estimated healthcare costs and utilization. The advantage of CBT is that the effects are long-lasting, which means that there are no ongoing treatment costs. Therefore, CBT has the potential to produce substantial long-term savings, especially when individual results are extrapolated to the large population of insomnia patients in the healthcare system. CBT can also impact suicidal ideation attributed to sleep issues. Self-reported insomnia and poor sleep quality are risk factors for suicide. Sleep complaints also were listed among the top suicide warning signs. Results of one study showed that about 21% of participants with insomnia reported having suicidal thoughts or wishes during the past 2 weeks. Group cognitive behavioral therapy for insomnia produced a statistically significant post-treatment reduction in suicidal ideation. Treatment sessions were conducted weekly until the final 2 sessions, which were conducted biweekly. Sleep-targeted interventions, therefore, have a therapeutic impact on suicide risk specifically. This suggests that a treatment focus on sleep disturbances may have important implications for the prevention of suicidal behaviors. Even online insomnia interventions based on established face-to-face cognitive behavioral therapy techniques improved patients' sleep. One highly interactive 9-week online CBT program used text, graphics, animations, vignettes, quizzes, and games to present behavioral, educational, and cognitive techniques for improving sleep. For instance, patients were advised to avoid reading and watching television in the bedroom, stop daytime napping, and change unhelpful beliefs and thoughts, including worries about the consequences of insomnia, that may exacerbate sleep difficulties. Participants completed daily sleep diaries before and after the intervention, and also rated their symptoms. Among individuals who received the intervention, scores improved, whereas scores did not change for the control group. These gains were maintained at a 6-month follow-up assessment. The placebo effect has been shown to have a much larger impact on sleep medications than was commonly thought. Researchers have reanalyzed results from more than a dozen clinical trials of the most common type of sleeping tablets, known as Z drugs, non-benzodiazepine hypnotics. Academics conducted a meta-analysis of data from clinical trials of Z drugs compared to drug effects with placebo effects. They used data submitted by pharmaceutical companies to the U.S. Food and Drug Administration, FDA, for approval of new products. This included 13 clinical trials containing 65 different comparisons and more than 4,300 participants. The FDA collates results from both published and unpublished studies, enabling researchers to avoid common types of bias, such as reporting bias, which can undermine other research based on sponsored trials. The findings indicate that once the placebo effect is discounted, the drug effect is of questionable clinical importance. Z drugs did reduce the length of time it took for subjects to fall asleep, both subjectively and as measured in a sleep lab, but around half of the effect of the drug was a placebo response. There was not enough evidence from the trials to show other benefits that might be important to people with sleep problems, such as sleep quality or daytime functioning. The researchers noted that psychological treatments for insomnia can work as effectively as sleeping tablets in the short term and better in the long term. So more attention should be paid to increasing access to these treatments for patients who might benefit. Melatonin is a critical hormone produced by the pineal gland, located in the brain, in the absence of light stimulation. This hormone, present throughout the animal kingdom, is responsible for regulating sleep and circadian rhythms. A research team has discovered that two principal melatonin receptors played opposite roles in sleep regulation. One type of melatonin receptor acts on rapid eye movement, REM sleep, and blocks non-REM sleep, while the other melatonin receptors favor non-REM sleep, also known as deep sleep. There are several factors at play when you are starting to feel tired. Sleep is thought to be regulated by two mechanisms: a homeostatic mechanism, which responds to the body's internal cues for sleep, and a circadian mechanism that responds to external cues, such as darkness and light, signaling appropriate times for sleep and wakefulness. For years, researchers have known that melatonin production is regulated by the circadian clock, and that animals produce more of the hormone at night than they do during the day. Melatonin normally plays an important role in sleep, and you need this natural melatonin both to fall asleep and to stay asleep. Adenosine, which was referred to earlier in this training, is a part of the internal mechanism that promotes sleep. As an animal expends energy throughout the day, adenosine accumulates in the brain, causing the animal to feel more and more tired, a pressure that is relieved through sleep. Melatonin may be promoting sleep, in part, by turning on adenosine, providing a long sought-after link between the internal and external processes that regulate sleep. Researchers have hypothesized that the circadian clock drives the production of melatonin, which then promotes sleep through yet-to-be-determined mechanisms, while also stimulating adenosine production, thus promoting sleep through the internal homeostatic pathway. Using melatonin could provide more and better quality sleep compared to using an eye mask and earplugs in a simulated, noisy, and illuminated environment, according to other research. Study participants that used either eye masks and earplugs or oral melatonin had improved sleep. Those who took melatonin were found to have decreased awakenings during the night, even compared to the eye mask and earplugs group. The quality of the sleep was also found to be much improved for those taking melatonin, which reported lower anxiety levels and increased REM sleep, thought to be linked to improved cognitive restoration. Both use of oral melatonin and use of earplugs and eye masks improve sleep quality at different levels, especially melatonin. Discomfort from use of earplugs and eye masks might affect sleep quality, which wasn't reported with melatonin. Therefore, compared to earplugs and eye masks, melatonin showed better performance and effectiveness and the tolerance of participants. Over 20 million people in the United States take beta blockers, a medication commonly prescribed for cardiovascular issues, anxiety, hypertension, and more. Many of these same people also have trouble sleeping, a side effect possibly related to the fact that these medications suppress nighttime melatonin production. When study participants who took beta blockers were also given melatonin supplements, they had a 37-minute increase in the amount of sleep compared to those who received placebo. They also found an 8% improvement of sleep efficiency and a 41-minute increase in the time spent in stage 2 sleep, without a decrease in slow wave sleep or REM sleep. Over the course of 3 weeks, none of the study participants taking the melatonin showed any of the adverse effects that are often observed with other classic sleep aids. There were also no signs of rebound insomnia after the participants stopped taking the drug. In fact, melatonin had a positive carryover effect on sleep, even after the participants had stopped taking the drug. Melatonin also has effects on blood glucose in some with a common genetic mutation. In another study, researchers charted the effect of melatonin supplements on blood sugar control. The results suggest that taking melatonin close to mealtimes may put people with a common genetic variant more at risk. People therefore may need to exert caution when taking melatonin close to mealtimes, especially in carriers of the genetic risk variant. As many as 50% of people of European ancestry carry this genetic variation in a gene that encodes a melatonin receptor. Previous studies have found that this mutation increases a person's risk of diabetes. The effects of melatonin on the ability to control blood sugar levels differed significantly between carriers versus non-carriers. Findings showed that the carrier's ability to control blood sugar levels was 6 times worse than non-carriers. When subjects take melatonin, the genetic risk variant causes a much greater change in glucose tolerance in carriers compared to non-carriers, even in people who are not obese and not diabetic. The results suggest that it may be important to take genetics into account when thinking about timing of food consumption and melatonin administration. In patients with cirrhosis of the liver, histamine levels in the brain can be altered. Histamine regulates the sleep-wake cycle, so if levels of this chemical get out of balance, so do sleep patterns. Hydroxyzine is an antihistamine medication that was tested in a study to see if people with liver cirrhosis would have their sleep increased after taking it. In the study, 65% of the patients receiving hydroxyzine before bedtime experienced improved sleep quality. Multiple studies have shown the positive impact that exercise can have on sleep. One study showed that a session of moderate aerobic exercise, but not heavy aerobic or moderate strength exercises, can reduce the anxiety state and improve the sleep quality of insomnia patients. According to the results, after the exercise session, reductions were shown in sleep onset latency and wake time in the moderate aerobic exercise group, while increases were shown in total sleep time and in sleep efficiency. Finally, a significant reduction in anxiety states was also observed after moderate aerobic exercise sessions. Regular aerobic exercise dramatically improves the quality of sleep, mood, and vitality, according to another study. An aerobic exercise trial resulted in the most dramatic improvement in patients' reported quality of sleep, including sleep duration, compared to any other non-pharmacological intervention. After a conditioning period, an aerobic physical activity participant group exercised for 2 20-minute sessions 4 times per week, or one 30 to 40-minute session 4 times per week, both for 16 weeks. Participants worked at 75% of their maximum heart rate on at least 2 activities, including walking or using a stationary bicycle or treadmill. Participants in the non-physical activity group participated in recreational or educational activities, such as a cooking class or museum lecture, which met for about 45 minutes 3 to 5 times per week for 16 weeks. Both groups received education about good sleep hygiene, which includes sleeping in a cool, dark, and quiet room, going to bed the same time every night, and not staying in bed too long if you can't fall asleep. Exercise improved the participants' self-reported sleep quality, elevating them from a diagnosis of poor sleeper to good sleeper. They also reported fewer depressive symptoms, more vitality, and less daytime sleepiness. The participants' scores on the Pittsburgh Sleep Quality Index dropped an average of 4.8 points. A higher score indicates worse sleep. In a prior study using Tai Chi as a sleep intervention, for example, participants' average scores dropped 1.8 points. Another study showed that the positive benefits of exercise can take a significant amount of time to develop. Exercise regimens have been shown to take around 4 months to become effective. This is the first long-term study to show aerobic exercise during the day does not result in improved sleep that night when people have insomnia. The study also showed people exercise less following nights with worse sleep. So, regular long-term exercise is good for sleep, but poor sleep can also lead to less exercise. Rather than medications, which can induce sleep quickly, exercise may be a healthier way to improve sleep because it could address the underlying problem. The key message is that people with sleep disturbances have to be persistent with exercise. Physical activities such as walking, as well as aerobics, calisthenics, running, weightlifting, and yoga and Pilates, are associated with better sleep habits compared to no activity, according to another study. In contrast, the study showed that other types of physical activity, such as household chores and childcare, are associated with increased cases of poor sleep habits. The research used data on sleep and physical activities of 429,000 adults. Researchers measured whether each of 10 types of activities was associated with typical amounts of sleep relative to both no activity and to walking. Compared to those who reported that they did not get physical activity in the past month, all types of activity, except for household chores or childcare, were associated with a lower likelihood of insufficient sleep. To assess whether these effects are just a result of any activity, results were compared to those who reported walking as their main source of activity. Compared to just walking, aerobics and calisthenics, biking, gardening, golf, running, weightlifting, and yoga Pilates were each associated with fewer cases of insufficient sleep, and household chores and childcare activity was associated with higher cases of insufficient sleep. These results were adjusted for age, sex, education, and body mass index. Not only does this study show that those who get exercise simply by walking are more likely to have better sleep habits, but these effects are even stronger for more purposeful activities, such as running and yoga, and even gardening and golf. It was also interesting that people who receive most of their activity from housework and childcare were more likely to experience insufficient sleep. This shows how home and work demands are some of the main reasons people lose sleep. Yet another study showed that among healthy women, 12 weeks of yoga classes plus home practice compared with usual activity reduced insomnia symptoms. Aerobic exercise can help alleviate excessive daytime sleepiness among depressed individuals, other researchers have found. Researchers looking at blood samples identified 2 biological markers for the condition called hypersomnia, which is characterized by sleeping too much at night, as well as excessive daytime sleepiness in those with major depressive disorder. Exercise reduced the levels of the 2 biomarker proteins, resulting in reduced excessive sleepiness, researchers found. Hypersomnia, as well as insomnia, have been linked in the development, treatment, and recurrence of depression. Sleep disturbances are also some of the most persistent symptoms in depression. Identifying these biomarkers, combined with new understanding of the important role of exercise in reducing hypersomnia, have potential implications in the treatment of major depressive disorder. Researchers have previously found a negative loop in which sleep, inflammation, and depression interact and progressively worsen. The results of the current and previous research on insomnia suggests that exercise may be resetting this negative feedback loop. The findings suggest distinct mechanisms are involved in insomnia versus hypersomnia. Meditation may also be an effective behavioral intervention in the treatment of insomnia, according to research. Results of one study indicate that patients saw improvements in subjective sleep quality while practicing meditation. Sleep latency, total sleep time, total wake time, wake after sleep onset, sleep efficiency, sleep quality, and depression improved in patients who used meditation. The study gathered data from subjects with chronic primary insomnia. Participants were divided into 2 intervention groups for 2 months. Kriya Yoga, a form of meditation that is used to focus internalized attention and has been shown to reduce measures of arousal, and health education. Subjective measures of sleep and depression were collected at baseline and after the 2-month period. Another study showed that mindfulness meditation practices resulted in improved sleep quality for adults with moderate sleep disturbance in a clinical trial comparing meditation to a more structured program focusing on changing poor sleep habits and establishing a bedtime routine. Participants took part in a standardized mindful awareness practices intervention or a sleep hygiene education intervention. Participants in the mindfulness group showed improvement relative to those in the sleep hygiene education group. The mindfulness group also showed improvement relative to the sleep hygiene education group on secondary measures of insomnia symptoms, depression symptoms, fatigue interference, and fatigue severity. However, differences between the groups were not seen for anxiety, stress, or inflammatory signaling, a measure of which declined in both groups over time. According to the findings, mindfulness meditation appears to have a role in addressing the prevalent burden of sleep problems among adults by reducing their moderate sleep disturbances and deficits in daytime functioning, with short-term effect sizes in comparison with the status quo of clinical treatment approaches for sleep problems. Therefore, structured mindfulness meditation training appears to have at least some clinical usefulness to help moderate sleep problems and sleep-related daytime impairment, and effective non-pharmacological interventions that are both scalable and community accessible, such as meditation, are needed to improve disturbed sleep and prevent clinical levels of insomnia. A daytime nap could have cardiovascular benefits, according to other research. One study looked at the effect of a daytime nap on cardiovascular recovery following a stress test, and found that those participants who slept for at least 45 minutes during the day had lower average blood pressure after psychological stress than those who did not sleep. They split participants into 2 groups. One group was allotted a 60-minute interval during the day when they had the opportunity to sleep. The other group did not sleep during the day. The researchers also asked the participants to complete questionnaires assessing sleep quality and complete a cardiovascular reactivity task involving a complex mental subtracting exercise. Researchers measured the participants' blood pressure and pulse rates at regular intervals throughout the experiment. They found that daytime sleep seemed to have a restorative effect with participants in the sleep condition reporting lower scores of sleepiness than those who did not sleep. Although blood pressure and pulse rates rose in both groups between baseline and the stress phase, during the recovery phase, those who had napped had significantly lower average blood pressure readings than those who had not slept. These results show that sleeping between 45 and 60 minutes during the day appears to facilitate blood pressure recovery after a mental stress task in the laboratory. Daytime sleep, therefore, may offer cardiovascular benefits by accelerating cardiovascular recovery following mental stressors. Other research showed that a short nap can help relieve stress and bolster the immune systems of those who slept only 2 hours the previous night, according to a new study. The research data suggests a 30-minute nap can reverse the hormonal impact of a night of poor sleep. This is the first study that found napping could restore biomarkers of neuroendocrine and immune health to normal levels. The researchers used a randomized study design to examine the relationship between hormones and sleep in a group of healthy men who underwent 2 sessions of sleep testing in a laboratory, where meals and lighting were strictly controlled. During one session, the men were limited to 2 hours of sleep for one night. For the other session, subjects were able to take 2 30-minute naps the day after their sleep was restricted to 2 hours. Researchers analyzed the participants' urine and saliva to determine how restricted sleep and napping altered hormone levels. After a night of limited sleep, the man had a 2.5-fold increase in levels of norepinephrine, a hormone and neurotransmitter involved in the body's fight-or-flight response to stress. Norepinephrine increases the body's heart rate, blood pressure, and blood sugar. Researchers found no change in norepinephrine levels when the men had napped following a night of limited sleep. Lack of sleep also affected the levels of a protein with antiviral properties. The levels dropped after a night of restricted sleep, but remained normal when the subjects were allowed to nap. The changes suggest naps can be beneficial for the immune system. Napping may offer a way to counter the damaging effects of sleep restriction by helping the immune system and neuroendocrine systems to recover. Another study suggests that bright light therapy may improve sleep, cognition, emotion, and brain function following mild traumatic brain injury. The study involved individuals with a documented history of at least one mild TBI and sleep disturbance. It has been estimated that at least 50% of individuals with TBI experience some kind of sleep disturbance at some point following their injury, and sleep has been demonstrated to be essential for brain plasticity and may be important for recovery. Results show that 6 weeks of morning bright light therapy resulted in a marked decrease in subjective daytime sleepiness. This improvement was further associated with improvements in the propensity to fall asleep and nighttime sleep quality. Bright light therapy also affected depressive symptoms. Importantly, the research also shows changes in brain activation during a demanding cognitive task, suggesting that bright light treatment might yield changes in brain functioning. Improving sleep following mild traumatic brain injury could prove critical to maximizing recovery from the injury. Furthermore, bright light therapy is easy and minimally invasive and has no known serious side effects. Other research has shown that cooling the brain during sleep may help with insomnia symptoms. A reduction in metabolism in the brain's frontal cortex occurs while falling asleep and is associated with restorative sleep. However, insomnia is associated with increased metabolism in the same brain region. One way to reduce cerebral metabolic activity is to use frontal cerebral thermal transfer to cool the brain, a process known as cerebral hypothermia. Results of a study testing this show that there were linear effects of all-night thermal transfer intensities on sleep latency and sleep efficiency. The time that it took subjects with primary insomnia to fall asleep, 13 minutes, and the percentage of time in bed that they slept, 89%, during treatment at the maximal cooling intensity, were similar to healthy controls, 16 minutes and 89%. The most significant finding from this study is that we can have a beneficial impact on the sleep of insomnia patients via a safe, non-pharmaceutical mechanism that can be made widely available for home use by insomnia sufferers. The finding of a linear dose response effect of the treatment implies a direct beneficial impact on the neurobiology of insomnia that can improve the sleep of insomnia patients. In another study, the researchers reported that increased relative metabolism in several brain regions during non-REM sleep in patients with insomnia is associated with increased wakefulness after sleep onset. They speculated that these effects may result from increased activity in arousal systems during sleep or heightened cognitive activity related to processes such as conflict, anxiety, and fear. Encouraging clients who experience insomnia to run cold water over their heads, sleep with a damp cloth on their heads, or possibly even shower before bed may help with these issues. Exposure to nature has also been shown to impact sleep. One analysis of over 255,000 representative U.S. adults set out to learn whether there was an association between self-reported days of insufficient sleep and access to green space. Across the entire sample, individuals reporting 21 to 29 days of insufficient sleep consistently had lower odds of access to green space and natural amenities compared to those reporting less than 1 week. For men, the relationship between sleep and exposure to green space was much stronger than for women, and males and females 65 years old and over found nature to be a potent sleep aid. The researchers suspect that living near green landscapes is associated with higher levels of physical activity, and that exercise in turn predicts beneficial sleep patterns. But men appeared to benefit much more from their natural surroundings. The researchers speculated that women may take less advantage of nearby natural settings out of concern for their safety. Inmate clients obviously have severely restricted access to nature. Possible substitutes can be found through watching videos of nature, drawing and looking at nature pictures, and using guided imagery exercises focusing on nature themes. That is the end of this training. Links to different types of sleep tests, sleep guidelines, and handouts can be seen below. The reference section will follow. Thank you.